Good morning and good afternoon to all, depending on where you are joining us from. Thank you for joining this webinar to hear about recently completed research on heat-related public health impacts through practical and achievable strategies, including increasing tree canopy cover and reflectivity in urban areas. My name is Edith de Guzman. I'm Director of Research at LA-based TreePeople, where, among other things, I have the privilege of convening and facilitating the Los Angeles Urban Cooling Collaborative. A bit of housekeeping before we get started. If you're having any technical issues, please use the chat function in the Zoom toolbar, and our IT support, Matt, will be of help. We will have time for questions after all of the presentations have concluded, which you can either ask in written form or by audio. To submit your questions in writing, use the Q&A feature in your toolbar. To ask your question using audio, use the raise hand feature on the webinar controls, and we will call on you and unmute you during the discussion. I will repeat these instructions at the end of the webinar. We'd like to start today's webinar by thanking the California Energy Commission for starting their own webcast on energy efficient walls a little earlier this morning so that our two events would not overlap. If you missed that webinar, presentations will be posted on the Energy Commission's website, so please check that in the coming days. The webinar you are now attending will also be recorded and it will be archived on TreePeople's website. I will send out a notification once that's available. The Los Angeles Urban Cooling Collaborative is a multidisciplinary national partnership of universities, nonprofit organizations, community groups, and government agencies focused on designing data-driven, dynamic, inclusive approaches for cooling urban areas using strategies including trees, reflective surfaces, behavior change, and policy. We're happy to report that we are deep in discussions with more community organizations as well as universities, and that this slide will be even more crowded next time you see it. The partners responsible for producing the research you will hear about today include 5 university entities: the UCLA Center for Public Health and Disasters, the University of Miami Miller School of Medicine, and researchers at Arizona State University, Kent State University in Ohio, and Yale University. We also have strong nonprofit representation through TreePeople and Climate Resolve, both located here in Los Angeles, as well as Global Cool Cities Alliance, located in Washington, D.C. In addition to the partners who are on the hook to actually get the work done, we are fortunate to have a growing contingent of supporters. We're grateful for funding from the USDA Forest Service through its National Urban and Community Forestry Advisory Council and the Harvard Westlake School. We also thank the other entities you see on the screen for their interest and support, including the City of Los Angeles' Mayor's Office, 3M, the Los Angeles County Department of Public Health, and C40 Cities Climate Leadership Group. LAUCC formed in 2015 because heat is the biggest weather-related killer in the US and is a significant risk to low-income communities of color, even under current conditions, whether climate change is factored in or not. We know this to be true, and we also know that practical solutions are within reach. Not all regions in the country are under the same threat, however, but as you can see on the slide, Los Angeles is within one of those regions. This is due to the fact that LA experiences high day-to-day variability in weather, and it's that inconsistency that renders LA particularly vulnerable. Regions that we know to be more consistently hot tend to have better infrastructure and are more well adapted to the threat of heat. Our region also has a unique and dubious distinction. We have a greater number of winter days above 90 degrees Fahrenheit than any other region in the country. So our winters too can produce heat-related illness and death. I would like to introduce our first speaker, who will present on the project LAUCC has undertaken to study the problem and explore the solutions. Dr. Laurence S. Kalkstein is a professor and a member of the voluntary faculty at University of Miami Department of Public Health Sciences at the Miller School of Medicine. He is a bioclimatologist specializing on climate impacts upon human health and well-being. Kalkstein has served as a lead author and co-author on IPCC Working Group 2 chapters pertaining to the impact of climate change on human health, and shared the Nobel Peace Prize in 2007 with other IPCC lead authors. Throughout his career, he has published over 140 peer-reviewed manuscripts, monographs, and book chapters in leading climatological, geographical, and medical journals, and has been editor for 2 major climatological journals. Larry, we're going to go ahead and turn it over to you now.
Hopefully everyone can hear me.
Yes, we can hear you.
Excellent. Let me go do the share screen and we're all set. So anyway, it's a pleasure to be part of this collaborative. Edith and I had conversations in 2015, which led to where we are now. And we have such a wonderful interdisciplinary team that it truly makes us all very proud. What I would like to do first is talk about the goals of our project, which we've titled Cooling Los Angeles to Save Lives, Neighborhood-Based Climate Modeling, Community Engagement, and Heat Mitigation. The first thing is we want to determine how an increase in tree cover and albedo being a measure of the reflection of solar radiation from the Earth's surface, can lead to a cooler environment in summer by developing a series of cooling scenarios, which involve both increased tree cover and use of materials that makes the urban surface more reflective. Would this be significant enough to actually lead to a decrease in heat-related mortality? And as we said, heat is already the nation's leading weather-related killer, so this would be a very important thing if these cooling scenarios are significant enough to do this. We are approaching this in several ways, but first we developed a generalized model for LA County, for the entire county, to determine how the county as a whole responds to hot weather and how many deaths occur, and to see if we can actually estimate these deaths developing formulas. After this, and this part has been completed. After this, we are dividing LA County into smaller regions, which we probably misname as neighborhoods because they are larger. Edith will show a map of these neighborhoods later. And we've divided LA into about 14 different areas of homogeneic demographics. And we want to see how the different neighborhoods respond, wealthy versus poor, inner city, and so on. So that'll be the next stage of our project. Now, I am a synoptic climatologist, which is a little different than most of the climatology that you know about. We evaluate entire weather situations or the entire umbrella of air that is over us at any given time. You may have heard of hot tropical air masses and cool polar air masses. We deal with trying to identify the different air masses that go over an area. And there may be about 10 that hit Los Angeles in the summer. Of these, 2 are particularly oppressive. DT, or dry tropical, which is a hot desert air mass that's associated with Santa Ana's, and then a moist tropical plus air mass, which is often found, for example, when the monsoonal conditions occur over Los Angeles. It's a more humid hot air mass with a little more cloud cover. Dry tropical is a basically transparent air mass with a lot of solar radiation input. We can map these air masses on a daily basis and actually see them move across the country. Excuse me, let me go back to this one here. And you could see this area, which is a map of July 14th, 1995 air masses around the country. This dark green is a moist tropical plus air mass that was over much of the eastern and midwestern US and was responsible for killing more than 800 people in Chicago. As I said, these air masses drift across the country, and I think this is a very easy way of determining which parts of the country are really very vulnerable to the vagaries of heat or any other environmental factors such as pollution, because certain air masses have lower air quality than other air masses. So we find the use of these air masses to be very, very important in delineating conditions that are conducive to negative health outcomes. And in this case, we're talking about heat. Now, when you look at these two air masses, the DT, dry tropical, and the moist tropical plus, we have a way of determining what mortality is like when these air masses exist. And I wanted to go through this figure with you very quickly to show you what we're talking about. Let's begin with New York. That 11% means that 11% of the days in New York are within either DT or MT plus air masses, the two offensive ones. Some years there may be no days, other years there may be 25% of the days. It varies from year to year, as you'll see when I discuss it later. When a DT air mass is present, on average, mortality in New York increases by 16.6. That's the average number of extra deaths. That represents a 7% increase over the baseline of New York mortality, which is rather amazing that when this air mass is present, it averages about 16 to 17 more deaths. Same with the MT plus, almost the same response of both. Obviously, some days you can have only a few extra deaths. Other days you have many of them. It varies, but it's really quite remarkable when you see this. Even a city like Seattle, which has 6% of the days in these air masses, have extra deaths. It's a smaller city, so 3.7 extra deaths equals 8%. You might say, how can that be? It's cooler in Seattle. Well, remember, Seattle has very much less air conditioning saturation, a different urban structure. The people aren't accustomed to heat, so at the rare times it occurs, these conditions happen. And there's Los Angeles. 4% of the days are within these air masses, and we get, much like New York, about a 5% increase in deaths. That's an extra 8 to 9 extra deaths, as you can see. Some of the southern cities like New Orleans and Phoenix have very few days that actually kill people. There is no DT air in New Orleans. You don't get desert air there, nor is there much MT plus in Phoenix. But in Europe, you can see these numbers are much higher because of lack of green space, very little air conditioning, and urban structures that are not conducive to being able to deal with the heat. And even Toronto, a city that we consider cool, is rather high. And I always like to fondly say that more people die of the heat in Toronto than in Phoenix. So this is the basic way we deal with this, looking at these air masses. And then the next step is to try to determine why some days within these air masses kill more than others. And I will discuss that later on in this webinar. But in the meantime, I want to introduce my good colleague, Dr. David Saylor, who has worked with me, and we've worked together for many years now. David is a professor at Arizona State University School of Geographical Sciences and Urban Planning. He directs the ASU Urban Climate Research Center. Prior to joining ASU, David Saylor was on the faculties of Tulane University and Portland State University. He served as the director of the South Central Regional Center of the National Institute for Global Environmental Change at Tulane, and he was the founding director of the Green Building Research Laboratory at Portland State. He received his PhD from the University of California, Berkeley, where he conducted research in collaboration with the Energy and Environment Division at Laurence Berkeley National Laboratory. David, I turn it over to you.
All right, thank you, Larry. I assume that folks can hear me. So as Larry mentioned, his work focuses on trying to assess mortality as a result of the different air masses. And of course, within the air masses, the actual characteristics of the temperature and the dew point temperature are very important contributors to mortality. So what we want to do in the modeling part of this effort is, hold on a second, try to advance my slide here. Okay, is to use modeling to assess the extent to which we can actually affect near surface air temperatures and dew point temperatures within a particular air mass by modifying the surface. So to do this, we use a model known as the Weather Research and Forecasting Model, or WRF. The current version that we're using is 3.81, so that's not the newest version out there, but it's relatively recent. That model allows you to create a domain structure that represents the urban area that you're interested in. And as you'll see in a minute, you'll see the nested domains that we use to represent LA County. The model also takes as input land use characterizations, including 3 different urban categories that it defines based on the NLCD database from 2011. Within each land use category, there are associated surface characteristics, things such as roughness, surface albedo, thermal properties, and vegetation. And so once we establish the characteristics of the modeling domain, we can then, in the modeling world, go in and change characteristics and see what effect that would have on the model output, and in particular, near surface air temperatures and humidities. The models are, of course, driven by large-scale forcing that we provide through various reanalysis products that provide vertical profiles at the boundaries of our domain and to initialize our domain. So our simulations include, to start with, a 7-day spin-up period for any heat wave that we're trying to analyze, just to get the model to really ramp up, to have some of the surface temperatures get up to speed in terms of what they should be for that time of year. And that is then followed by a 4 to 5 day heat wave simulation period. And that's the period that we're extracting data from to provide to Larry. We have looked at 5 historical heat waves, and for each heat wave, what we do is we model a control simulation, which we refer to as case 0. And so that case is essentially the current conditions for the city in terms of surface characteristics. We then validate that using airport data from the heat waves that we're simulating to verify that the model was actually replicating the historical heat wave accurately. And then we test 4 additional test case scenarios. So here's just an image of what the domain structure looks like. And of course, what we're interested in is the finest domain that's focused in on LA County. The need for the larger domain is just to ensure that for each simulation period, we're getting the general synoptic conditions correct in terms of driving the performance of the domain itself. So here's a zoom in at a fine domain for LA County. The stars in here are the 3 different airports that we use for validation of our simulations. So Bob Hope up in Burbank, the KCQT National Weather Service site at the USC campus, kind of in the middle, and then the John Wayne Airport down by Irvine. And so what we do is, as a starting point, as I said, we have to make sure that the model is doing a generally good job at replicating the historical heat wave that we're looking at. So these plots actually show 5-day diurnal profiles of ambient air temperature from the model compared with observations at 2 of the airports and for 2 of the heat waves. So the heat waves are referred to here by their dates. So August 26th, 09 is one of the heat waves, and then July 22nd, 06 is the other one here. And if you look at the results for both, this is just for Burbank and then for the USC site, excuse me, you see a fairly good agreement overall. The model is replicating the diurnal profile during these heat waves. Occasionally you will see little mismatches that are associated with a variety of things, everything from the model replicating local cloud cover that wasn't there in actuality, or vice versa, or the model slightly missing the timing of the sea breeze due to various factors. And so while these models are not perfect, it's clear that they do a pretty good job of replicating the historical conditions, so we feel comfortable in then exercising them with modified surface characteristics. So the cases that we looked at, to start with, as I said, case 0 is the control case. And so for the urban areas within the domain, The canopy cover in urban areas is currently about 16.6%. We've taken the albedo of pavement to be about 10% on average, and the albedo of rooftops to be about 17%. Just to clarify, the albedo is the reflectivity to the energy content of the sun. Case 1 then is a case where we really are looking at, even though this says low canopy and high albedo, in each of these cases, we improve the conditions of both canopy and albedo, but in this case 1, the focus is on high albedo surfaces. So for example, the pavement goes from 10% to 35% reflective, and the rooftops from 17 to 45, while the canopy cover only gets increased from about 17% to 20%. So that's case 1. Case 2 is a case where we focus on high canopy cover. These 2 cases allow us to sort of differentiate how important is increasing albedo versus increasing canopy. And then case 3 is more of a moderate canopy and albedo increase. So we increase both canopy cover and albedo, again, in the urbanized portions of the domain by what we consider to be a moderate amount. And then case 4, of course, is the more extreme case of a high canopy cover modification and high albedo. So these characteristics are modified within various files in our modeling structure for WRF that allows us to then, again, test not just the control, but these what-if scenarios. So a typical set of results are shown here. These are difference temperature contours for the finest domain in our simulation. And so this is focused pretty much on LA County. These sample output are our difference plots, the mitigation case minus the control case. So this shows the change in near surface air temperatures. Blue reflects cooling. And these results are just a snapshot at 3 o'clock in the afternoon on the 2nd day of the heat wave. These happen to be for a June 2008 heat wave scenario. And so what you see is throughout the domain, you have a fairly large cooling at 3 p.m. And you have little pockets of some somewhat confusing behavior where you see maybe little patches of light pink. These typically reflect the complexity of atmospheric flow. As you cool the surface of the city, you actually alter the sea breeze effect because you're lessening the difference in surface temperatures between the land and the sea. So some of these complexities show up as what you might think of as counterintuitive results. Nevertheless, the vast majority of LA County is cooled substantially through each of these cases. So here is more of a diurnal profile, a video showing the evolution over the course of a few days of just how complex that behavior is. And since we're really interested in understanding what's happening here in LA County, what we do is we take the hourly results from this entire domain and we zoom in on a box centered on the core of LA County and extract results from that. And so when we do that, we're able to provide Larry for his heat mortality modeling with changes in surface temperature and changes in dew point, again, for the test case minus the control case. So as these plots show, a negative value on this plot on the left-hand side, which is the temperature difference, a negative value refers to cooling. And on the right-hand plot, which is a change in dew point temperatures, a positive value represents an increase in humidity. So the increase in humidity it happens due to a number of factors, one of which, of course, is when you add vegetation, you add evapotranspiration from the surface, so you're increasing moisture input into the near surface air. The other fact is even in the albedo cases, as you cool the surface, you reduce the mixing height, and so any moisture that's evaporated from the surface anyway is mixed into a thinner boundary layer near the surface. So these are some of the complexities. We certainly see the cooling effect of these scenarios. We also see the potential adverse consequences associated with increased humidity. The question of the day, of course, is what's the net effect on heat-related mortality? And so that brings me back to Larry.
Okay, so you have heard what David had to say. He provides us with the simulated meteorologies for each of those 4 cases with increasing albedo and vegetation. And then we use that meteorology to try to determine if there are air mass changes or changes in mortality. But first, let's look at the actual spread of these air masses. This is not using David's meteorology. This is actual cases of the number of summertime days with moist tropical and dry tropical air masses. And you could see that they vary widely from summer to summer. In some cases, there could be as few as 4 days per season, and in other cases, as high as 70. So this is very typical of meteorology. There's a high variability, and that makes LA somewhat vulnerable anyway, because we said highly vulnerable climates are those which we have the most negative health outcomes. You can also see that the high and low years often get bunched together. That's also a hallmark of meteorology, where you have nothing for a while and then a bunch of years where something really dramatic happens. So you can see that this is a large variation in oppressive days from year to year. And actually, that's quite damaging to citizens because they don't know what to expect. And it's the unexpected that creates human behavior that is different and also negative health outcomes. Okay, let's see. For some reason, I am not getting it to move. There we go. So once we do this, and we know, we already showed you what the mean mortality is for each of those air masses for DT and MT+, we need to develop a mortality algorithm because, again, every day in a DT air mass doesn't kill the same amount of people. For example, maybe it's the first day of a DT air mass rather than the 4th day. Clearly, if you had 3 or 4 straight days of this air mass, you have an accumulative effect that's going to kill more people. So day and sequence is often an important part of this algorithm. Maybe one DT day is somewhat warmer than the other. That also can create a problem. Excuse me for again a second. These things are sometimes very sensitive and I just touched it. So mortality can vary widely from one oppressive day to another. And this is due to a variety of meteorological factors. Maybe some have higher overnight temperatures. As I said, it could be the 3rd straight day of an air mass. And some are non-meteorological. For example, in our research, we find that heat waves early in the season often kill more people than later in the season because people aren't adapted to the heat earlier in the season. Often, many of the susceptible people die earlier in the season, and they're less literally available to die later in the season if there's a heat wave. And that has to be taken into account in our estimates of how many deaths are going to occur. So we developed the algorithm, and this happens to be the generalized Los Angeles County algorithm. And there is the algorithm up there, a constant plus 5.22 DT. That is, whenever there is a dry tropical air mass, we add 5.22 deaths on average for each day. Plus 1.61 MT. MT means MT plus. You add 1.61 deaths for each MT plus day. Plus 0.0006 HiO5. HI is the heat index, which is the combination of temperature and humidity. You've often heard of the meteorologists say, today's heat index is 105 degrees. That's what the perceived temperature is, considering high humidity and high temperature. And of course, we put that value in there. And the afternoon, HiO5 is the 5 p.m. heat index, which turned out to be statistically significant. And then 0.36 HF. HF is a meteorological term called the Nairn heat factor. This looks at 3 consecutive days of heat and determines whether the period before the heat event was hot or comfortable. Why do we do that? If you have a heat wave and it was preceded by a cool period, it's going to have a much larger effect than a heat wave that was preceded by another hot period. So this has to be taken into account. And so we find this Nairn heat factor to be a good way of doing it. All of these variables in this predictive algorithm, which tells us what the percent increase over the baseline will be in Los Angeles mortality during a DT or MT plus day, all of these are statistically significant to the 0.05 level, meaning that there's a very good case to say that there are truly causal mechanisms. So we used that algorithm for all of those DT and MT days, and we estimated the number of deaths that you get in Los Angeles every single year. And you could see that, again, as before, some of the years that have low numbers of DT and MT plus days, like 2001, 2002, have few heat-related deaths. On the other hand, days that have many of these, like 1997, can have up to 250 or more deaths during this period. And you could see that, again, it's highly variable from year to year, much like mortality is in the United States. Over the 22-year period, if you add up these numbers, we count about 1,600 heat-related deaths in Los Angeles County. The fluctuations are great, and extended heat waves are the worst. That is, if you have 2, 3, 4 days in a row of these air masses, we find that if you, on the first day, we have a 4.1 increase in deaths over the daily average. But by the time you reach the 5th consecutive day in Los Angeles, that number goes to 11.9%. Now, what we are doing here, all of this work that LAUCC is doing, is under the hypothesis that these numbers can be reduced significantly, so that hopefully these 1,600 deaths that occurred over these 22 years could be greatly reduced. So as David told you, we selected 4 heat waves. We picked heat waves that were different in composition just to see how they would react. The July 2006 heat wave was a hot and humid one, all MT plus days. The June 19th to 22nd heat wave in 2008 was a mix of DT and MT days. It was drier. The August 20th, 6th to 30th, 2009 was a moderate heat wave. It wasn't as extreme as the other 3 because we wanted to see if we can have an effect on those heat waves that are relatively moderate. And then finally, the September 24th to 29th, 2010 heat wave was what most Angelinos dread the most, a very hot, dry Santa Ana event dominated by dry tropical days. So we looked at all 4 of those heat waves. And these are the results based upon the meteorology that Dave gave us for case 1, case 2, case 3, and case 4. Remember that case 2 and case 4 have the 40% vegetation increase, and that also case 4 is the most aggressive in terms of the albedo increase. And that's one of the reasons you see the darker numbers for case 4. Green represents, and the shading represents, the degree of cooling. For temperature, DT represents temperature. DTD represents dew point. For those of you who may not know, dew point is a measure of atmospheric moisture. It is the temperature at which the relative humidity is 100%. So as the temperature goes down, if it's 100 degrees and the dew point is 66 degrees, it means the temperature has to drop to 66 degrees to reach 100%. The higher that number, the more humid the air is. These numbers represent differences from the baseline. So this represents the difference from the control simulation that David showed us that represents the real heat waves. And you could see that some of these numbers often exceed 1 degree or 2 degrees centigrade. For those of you who are not good at converting this, 1 degree centigrade is 1.8 Fahrenheit. 2 degrees centigrade is 3.6 degrees Fahrenheit. And you could see some numbers, especially in case 4, that exceed 2 and even 3 degrees. Now think about that. Some of these numbers mean that we've cooled the temperature by 4 degrees in terms of how much less the temperature is than before. So 100-degree temperature gets reduced to 96 under that particular situation. By the way, this is every day of the heat waves. You can see the dates and the times. So you have them for 4 times a day. You could generally see that the greatest reductions, as you saw from Dave's map, were during the daytime because that's where the darker green colors are. Now, we don't want you to think that the heat wave is eliminated. It's not that suddenly we've made the day comfortable. That's not the goal of developing cool city solutions. You still have heat waves. What we want to do, and this is a very important point, is to bring conditions below the threshold where you get a negative health outcome. People might still be uncomfortable. They still might curse the heat, but they're not going to die, or they may not even have to go to the emergency room. That's the most important thing. As David also pointed out, there were dew point temperature increases, some of them as large as the temperature decreases, but most of them somewhat less. And David gave you the reasons. This is especially true in case 2 and 4 with the higher amounts of vegetation. We said about the increase in evapotranspiration because that's what vegetation does, and cooler temperatures inhibit vertical air motion, keeping moisture closer to the ground. But I want to point out that the drop in temperature is much more important than the rise in dew point. The heat index will go down if the temperature drops and the dew point rises at the same amount. Temperature usually accounts for about 3/4 of the heat index to 4/5. So temperature decreases will make a bigger dent on human comfort than the dew point increases, and therefore it will be more comfortable even if the increases in dew point are similar to the decreases in temperature. And now for the important part. What does this do to mortality and air mass changes using our mortality algorithm? And I wanted to start with the first heat wave, the moist heat wave with all MT plus days, the July 2006 heat wave. And on this table, you see all the days within it, 722, 723, 724, through all of them. The green shows the air mass type. When you see a dark green, and this is important, we have actually changed the air mass type. The cooling was enough to take the day from a very oppressive air mass to a less oppressive air mass. In this case, on the 22nd of July, from an MT plus to the MT in all 4 cases. The numbers are the apparent temperature, which is similar to the heat index, and the bottom number is the mortality increase using our algorithm, meaning that there was a 2% increase in mortality on the first day, 7.6% on the second day, and this is the simulation for the real heat wave, 14% increase on the third day, 14.4 on the fourth day. You can see the accumulation of days having an effect here, and then 10.3 on the 5th day, because that day was a little bit cooler. You can also see other air mass changes on these days. And for most of these cases, you see decreases as we move across through the different cases. So I want you to think about this for a second. Considering that about 150 people die daily in Los Angeles, an 8.1, this is the average increase for all of these days together, an 8.1% increase in mortality represents a fairly sizable number of deaths. 8.1% of 150 each day. So that's 150, 300, 450, 600, 750 deaths about estimated occurred during this period of time from all causes. We increased it by 8.1%. That's 61 deaths from heat under the regular conditions, under the baseline conditions. We estimated that this heat wave, 8.1% of 750, caused 61 deaths from heat. Notice that this number is going down as you move to the most aggressive one of the cases, where finally, when you go to case 6, that's an 18% decrease in deaths from the 8.1 because it was only 6.6. That's a 1.5% decrease. If you put 1.5 over 8.1, that's how you get 18%. Well, what is 18% of 61 deaths? Turns out to be 12. So you have reduced, using the scenario 4, those 61 heat-related deaths down to 49 lives. Thus, we estimate that 12 lives were saved using case 4 of these scenarios, the most aggressive case. And that's really quite a bit of difference to have saved 12 lives and gone from 61 to 49, an 18% decrease. We think that's important. And the other 3 scenarios show decreases as well. It's just that the most aggressive one shows the most. Now, I didn't want to show you 4 of these, so I wanted to summarize the middle 2 heat waves, and then I'm going to show the Santa Ana. The 2008 mixed event with some dry and some humid days showed temperature decreases as well, often exceeding 2 degrees centigrade or close to 4 degrees Fahrenheit, and dew point increases were similar to the 2006 event. This event also showed mortality decreases between 8 and 18%. For the case 4 scenario, this was the equivalent of 6 saved lives. This heat wave wasn't quite as bad as the other, so even though it was 8 to 18%, the number of lives saved was less. The 2009 was the common event, the one that isn't too extreme, showed similar meteorology changes and mortality decreases of up to 50% for case 4. Now, since not that many people died in 2009 as compared to some of the others. We went from 20 to 10. Remember, 61 died in that first heat wave, but that's still a saving of 10 lives under that circumstance. And then finally, I want to show the Santa Ana event because this was the worst event of all. And it seems that the Cool City solutions may actually be most effective for this type of event. Once again, they're mostly DT days with one MT thrown in. And very importantly, in the 2 or 3 of these scenarios, DT was changed to DM, which means dry moderate. That is a totally unoffensive air mass. It cooled enough to move out of the dry tropical category into the dry moderate, which meant that the mortality increase went from 5 to 4.9 in case 1 to 0 increase in those other days because we were in a non-offensive category. And now, when you looked at all of this, and now we're talking about a period where there was 150, 300, 450, 600 deaths approximately because of the 150 people that die in LA County every day. The mean 4-day increase for this Santa Ana event was 12.4%. We reduced that to 8.8%, which is a 29% decrease using the most aggressive scenario. And it decreased rather significantly for the other 3 scenarios as well. But we were very impressed with that 29% decrease. Thus, if you look at this heat event, 12.4% is 74 extra deaths. That's 12.4% of 600 deaths that occurred there. Under the case 4 scenario, we went to 8.8%, which was 52 extra deaths in this case. That means we went from 74 to 52 extra deaths and saved 22 lives, we estimate, during that heat wave. And this is my final slide. The outcomes suggest that there were substantial decreases in temperature, sometimes increasing 4 degrees Fahrenheit, and more modest increases in dew point for all the heat events. Some of the days, and this is impressive to me as a synoptic climatologist, showed actual air mass changes from oppressive to benign. We estimate that the application of the case 4 scenario would have saved a total of 49 lives when you summarize all 4 of those heat waves. 49 lives were saved in those 4 heat waves. The other scenarios would have yielded a smaller but still significant number of lives saved. Now, when you consider that the number of heat events in Los Angeles are many more than 4, this can be translated to hundreds of lives saved per decade by increasing albedo and tree cover. After all, if 4 heat waves save 49 lives, in a decade, we could have 20 heat waves. How many lives would be saved if there were 20 or 25 heat waves? Many, many more. And finally, we will now proceed to the neighborhood analysis because we want to see which parts of LA are most vulnerable of heat in terms of the vagaries of heat. Obviously, it is not evenly distributed throughout the city. I would doubt that the Bel Air, Beverly Hills area has a similar effect in terms of heat mortality as does South Central. And that's what we are going to do now. And I'm happy to report we have our first results for the first 4 neighborhoods. I am just checking them over again. I haven't even divulged them to my team yet. So I will not be able to divulge them to any of you, but I will tell you that they are impressive. And I'm very excited about telling you about them in the future.
Thank you, Larry and Dave. In just a moment, we will turn to Dr. David Eisenman. So David, if we could get your slides up at this time. For those of you who joined a bit late, just a reminder, we will have time for questions after all of the presentations have concluded. And you will be able to ask your questions either in written form or by audio. To submit your questions in writing, you can use the Q&A feature in the toolbar, and to ask your question using audio, you'll be able to use the raise hand feature on the webinar controls. Dr. David Eisenman is a professor at the David Geffen School of Medicine at UCLA and has a joint appointment at the UCLA Fielding School of Public Health, where he directs the Center for Public Health and Disasters. He is also an associate natural scientist at the RAND Corporation. Dr. Eisenman has studied disasters, community resilience, climate change adaptation, violence, and refugee health with research funding from the National Institutes of Health, National Institutes of Mental Health, Centers for Disease Control and Prevention, National Science Foundation, USAID, Robert Wood Johnson Foundation, and other federal, state, and local agencies. David?
All right, thank you very much. It's a pleasure to contribute to this webcast. It's hard to follow that kind of cliffhanger, Larry, but I will keep my remarks brief. I'm going to focus on how this work bridges the fields of disaster research and climate research. So California has long been a leader in advancing climate change in health policies. Well before the Lancet Commission of Climate Change and Health published their document in 2015, our state and local public health officers were already vocal regarding the need for health to play a larger role in climate change adaptation and mitigation actions. Jonathan Fielding, who will be following me, is an excellent example of this. There has also been calls for alignment of disaster risk reduction and climate change adaptation. And indeed, I would say that the possible synergies between these two areas have not been fully realized, and that this area is still in its infancy. So disaster risk reduction can be described very generally as mainly concerned with non-climate related hazards such as earthquakes, and in the case of public health, biological threats such as pandemic influenza. It is often historically based because often the hazards we prepare for are in response to the disasters we have had. I would say that it is often focused on the short to medium term timelines, the next years to the next decade. And it is most focused on preparedness, meaning ensuring an effective response, and then the response itself. In public health, this means less attention to mitigation, that is, limiting the adverse impact of a hazard. And then lastly, research is often event-based. Climate change adaptation policies are, of course, focused on climate change-related shocks and stressors. Much of the work has been projection-based and mitigation-based. And it has a long-term focus, often with slow onset shocks such as drought. Climate and health research is largely dominated by identifying vulnerable populations, risk quantification, and risk projection studies. So the two fields can and do meet in a common concern with climate-related disaster risks inside what's called a multi-hazard risk approach. They also share a focus on vulnerable populations and the value it places in both on multi-sectoral approaches. And lastly, I would say the concept of resilience provides a bridge between the two areas too. From my experience, while the knowledge around how to build links between disaster risk reduction and climate change adaptation is growing at a conceptual level and a policy level, there is still little research and really a paucity of documented practice concerning how to link the two fields, especially within the health sector. And I would say that LAUCC, the collaborative presenting today, really fills that gap. So LAUCC adds to the list in the following ways. Heat waves are a historical and current problem, as we have pointed out. We don't need to invoke climate change for this work to be relevant. So it's concerned with the historical, the present, and of course the future. So it follows that it has potential short, medium, and long-term impacts. It is primarily an adaptation approach with potential mitigation value, though this would need to be researched. LAUCC is a community-based project. In the next phases, which we have not presented on today, we hope to be engaging with communities to implement retrofits, to look at behaviors, and to evaluate the outcomes. So it will therefore marry structural and non-structural approaches to reducing vulnerability and exposure. Finally, when we get to perform our later work, we will be able to fill research gaps around the implementation, the appropriateness, and the effectiveness of climate change adaptation for health. That's really all I have to say. It's been a privilege to share my thoughts with you. Thank you. And it's now a privilege to introduce our next speaker. Jonathan Fielding, Dr. Jonathan Fielding is the former Director and Health Officer of the Los Angeles County Department of Public Health, where over his 16-year tenure, he was responsible for a full range of public health activities for over 10 million county residents. He is a distinguished professor at UCLA in the Fielding School of Public Health and the Geffen School of Medicine. Dr. Fielding is founder and co-director of the Center for Health Advancement, Education, and Research at UCLA, where he helped develop the first comprehensive university-based center to focus on clinical and worksite prevention opportunities. We are delighted to welcome Dr. Fielding to today's discussion.
Well, thank you so much. A very generous introduction and an exciting group. And I have just a few comments. First of all, I just think this is an excellent example of the kind of collaboration we need if we're going to attack some of these very large environmental problems. Even though the nomenclature may be new to some, including me, there's not a lot of terms you need to know to start understanding what's required to make a difference, because in public health, that's what our interest is, not only to do the research, but then to try and change things. And I think, therefore, the modeling and the scenarios that have been done, changing the canopy, changing the albedo are absolutely critical. A couple of things. One, if you look at death records, you wouldn't pick this up. You wouldn't pick these increased deaths up because there's not what you'd see in a death record. There are people who have other problems, respiratory problems, cardiovascular problems, and they're just pushed over the edge by these excess heat days. So you won't find it on the death certificate. This is the kind of modeling that's being done here is really the only way to try and really identify them, which is important because that tells us where we need to focus our efforts to try and prevent these excess deaths. But the other point I'd make is that death is one outcome, but there are many more problems due to heat. And if you look at the number of people who are debilitated, the number of people who wind up going to their doctor or go to the emergency room, who have to spend time with a friend because their place isn't air conditioned. There's a lot of problems associated with this, some health problems, some other problems that aren't really picked up in this approach. And so for every extreme event, which we'll call death, there must be 10s, 20s, maybe 100 effects that we are not capturing that are significantly, there are less, but that do affect human mobility and flexibility, perhaps work, school, etc. So let's understand that this is just the tip of the iceberg. I think the other important issue here is there are so many different areas in Los Angeles. Los Angeles County is about 4,000 square miles, and that's huge. And there are differences in the temperature profile and climates, and certainly in weather, between different parts of it. So dividing this up into different areas, I think, has been a very important advance. Finally, I think the focus has to be on what do we do. And the issues of tree canopy, the involvement of TreePeople in this, I think, is very important. And increasing the albedo is also extremely important, not just because of the impact on heat, but because of the impact on energy consumption. If you have a place that has a roof that's not reflecting much of the sunlight and sun heat, you're going to have to spend more money on air conditioning, so it's going to have impacts for for what you do locally, and cost impacts, economic impact. I think that's one of the other opportunities going forward, to do more economic analysis. Finally, I think it will be important to adapt these models for other cities that were shown, particularly in the Southeast corridor, and to try and get collaboration on not only what we are finding out and validating it, that it works in different areas, but particularly focusing on what we can do to help, and then finding out that, in fact, the number of excess deaths and other problems have been substantially reduced. So that's all I had to say, but I'll be happy to stay on and answer any questions that I can from a public health perspective.
Thank you very much, Dr. Fielding. Just to introduce myself again, for those of you who may have joined late, the voice you're hearing now is of Edith de Guzman. I am the Director of Research at TreePeople, and I am the convener and facilitator for the collaborative from whom you're hearing today. I will spend just a few, our few remaining slides here foreshadowing some of the next work that our collaborative is working on, and then we will open it up to Q&A. So over the next year or so, we will continue to build on the research that you heard about today. And what you can expect to hear about from LAUCC in the not too distant future includes a few things. First, detailed neighborhood analysis. I'm trying to mute, I'm hearing some background noise here. Hopefully that took care of that. So first you'll hear a detailed neighborhood scale analysis where our researchers will identify, as Larry indicated, neighborhoods most vulnerable to heat-related mortality, and we will then quantitatively determine the differences in terms of sensitivity, looking at population concentration, socioeconomic status, housing condition, access to air conditioning, and of course, urban tree canopy and concentration of heat retaining surfaces. At that stage, we will then run a neighborhood-specific heat mortality model to test what combinations of changes in urban forest and albedo would do to temperature, humidity, air mass type, and heat-related mortality during selected heat waves, which follows much of what you heard about today for the entire county. The next phase will be more granular, and results will thus lend themselves more readily to implementation at both the community level and in policies. Lastly, we will run climate projections to determine cooling that would occur under various climate change scenarios if urban forest cover and albedo were increased, and we will quantify the health consequences of these changes for different decades in the latter part of the 21st century. But as you heard about today, that step is really just extra because these are issues that are happening today, and we have heat-related mortality and illness which occur even now. In terms of this next phase of neighborhood analysis, here is a sneak peek at how we are approaching that more granular analysis. With feedback from our entire collaborative, a Cal State University Northridge team developed typologies of contiguous areas within LA County that have sufficiently similar socioeconomic and climatic characteristics to be somewhat homogeneous. For a region as socially, topographically, and climatically diverse as Los Angeles, this is a tall order, but it's an important step toward developing strategies for engaging residents and decision makers with community-appropriate programs and policies to mitigate heat and heat impacts. The numbers you see over each polygon indicate population numbers and are really much too large to be actual neighborhoods. But because at this point our analysis is focused on reducing mortality, we have to choose areas that are quite populous in order to be able to see reductions in heat-related death, and in order to have the types of percentages that you saw Larry present translate into actual lives saved. While we work on the research, we are concurrently active in engaging with policymakers and communities to start taking action toward heat mitigation. We are pleased to have this important work reflected in the resilience strategy of the City of Los Angeles, released earlier this month. The strategy is part of the 100 Resilient Cities, an effort pioneered by the Rockefeller Foundation, which is dedicated to helping cities around the world become more resilient to the physical, social, and economic challenges that are a growing part of the 21st century. The city's strategy presents 15 goals and 96 actions, including a goal to prepare and protect those most vulnerable to extreme heat. LAUCC and the city are committed to working together to realize several critical related actions, including drafting an urban heat island mitigation plan for the city and implementing a neighborhood retrofit pilot to test cooling strategies that can be conducted with residents and volunteers. We are seeking funding for to support these types of particular actions. So if you know someone who would find this work, let's say, particularly cool, our partners would be happy to have a conversation with them. LAUCC is also working with the LA City Council to take action. Based on lessons from a policymaker delegation tour of Australia led by TreePeople and the Energy Coalition to learn how that country navigates extreme heat issues, a motion has been introduced into the LA City Council to form a committee on cooling and urban heat impacts. This committee will guide establishment of targets and strategies for temperature reduction and tree canopy cover and coal pavement increases. LAUCC is working with City Council member Bob Blumenfield and his staff to take next steps. In future phases of the research, we will conduct social science research, as you heard some of our presenters foreshadow. And this will really be an opportunity for us to examine interactions between social factors and heat risk, and also to determine the resilience strategies that can promote climate justice and equity. Researchers from California State University Northridge will model how health disparities in chronic illnesses, as well as heat-related morbidity and mortality, are impacted by multiple factors, including tree canopy and vegetation rates, housing condition, access to healthy food, access to health services, and behavioral factors such as health knowledge and culturally influenced health decision-making. With the data emerging from the heat health modeling and social science field research, our intent is to deepen our partnerships with local government, with communities, nonprofit organizations, academia, and private industry and practitioners to apply community and policy interventions in and around Los Angeles. Sharing our process and results and opening up a dialogue with a wide array of traditional and non-traditional partners is part and parcel of our approach. Toward that end, we have and will continue to host in-person events and webinars such as this one, and will produce materials to disseminate information and about how to advance an interdisciplinary research approach such as ours, and will tie it to implementation at both the grassroots and policy levels. With that, we welcome your thoughts, and we will now open up our Q&A session. Again, to submit your questions in writing, use the Q&A feature in your toolbar to ask questions using audio. Use the raise hand feature on the webinar controls, and we will call on you and unmute you during the discussion portion. We'll just take a few moments here to get that all started. Okay, we have a question coming in from our own founder and president, Andy Lipkiss. Let's see if we can go ahead and unmute you, Andy.
Hi, really glad to be on this webinar with all of you, and so pleased to hear the results that are coming in. And I want to especially mark what Dr. Fielding said in terms of there's so much more to know, and I don't want you, you're not prepared to talk much about that, and you gave us some headlines, but it's really, really good, because I think as we begin implementing this, we need people to know that there's just a larger body of work that supports investment in mitigation, investment in furthering the research. And so, Jonathan, if you have any further words that you want to add on places that downrange we should be broadening the investigation or bringing in partners who could add impetus to this work, that would be really helpful.
The only thing I would say at this point, because there's so many potential partners, is that some of the organizations that deal with aging and deal with older adults would be important partners in terms of what to do to try and mitigate the effects. Because these people are oftentimes not prepared, less likely to have air conditioning, and less likely to be sensitive to some of the public pronouncements and suggestions for how people can avoid the worst consequences of exposure.
Wonderful, thank you very much. We've got a couple of questions that are coming in here. We have a partial question from Alex. Do we have information on how trees compare to other? Alex, if you can try to complete your thought there, we'd be happy to answer that question. We also have a question from Catherine Goldman. I'd be interested in learning more about how the neighborhood typology was developed. Is there a report that you can share? Catherine, I'll take a stab at answering this, and I invite my colleagues to chime in as well. The neighborhood typology development was led by our team at Cal State Northridge, which is composed of an anthropologist and a geographer, Kimberly Kerner and Reagan Moss. And they looked at a variety of different aspects in order to be able to define these contiguous large areas as somewhat homogeneous. So we do not at this point have a report, so to speak. We do intend to document all of our various processes and share those. We're sort of still in the thick of it right now, but I will be happy to speak with you offline, and I of course we can speak about that in greater detail later. Anyone on the team care to provide a little bit more about that? Okay. All right. Another question that we've received is, do we have any information on how trees compare to other heat-reducing strategies, such as light-colored roofs, and whether there is a significant difference by tree species? Dave Saylor, I would probably nominate you to maybe begin to answer that question, and we can see if others also wish to chime in. Dave?
Sure. So I assume you can hear me now. So that that is one of the shortcomings of any modeling effort, is we have to make some assumptions about not just the tree species, but also the management of the trees. Obviously, if you have a lightly irrigated versus a desert adapted versus a heavily irrigated tree, the evapotranspiration characteristics change dramatically, as do then the resulting impacts on near surface air temperatures. Also, we have to keep in mind that while Larry's health outcomes modeling focuses on the effect of temperatures on mortality, trees also provide a different kind of benefit, and that is that they can provide shade from direct radiation. So even if the trees did not affect ambient air temperatures, the fact that they provide a location for you to seek shelter actually can have very, very positive health effects. So the short answer is that trees and high albedo surfaces both have been demonstrated through various studies to have a non-trivial potential benefit for urban climate. Typically, they're on the same order of magnitude in terms of the different strategies that are employed and how they perform. The actual performance, of course, depends a little bit on, as was suggested by the question, the tree species, but also the management strategy of the vegetation itself. So that's my sort of 2 cents. If anyone else wants to add, that'd be good.
Thank you, Dave. Just to address the difference between tree species, we do not have funding to pursue that question at this phase, but this is certainly something that we are very keenly aware of as something that needs to be looked at, because it will not be a simple task to raise the tree canopy in a region that is threatened not only by drought, but by pest infestations. So this is a foremost question that we want to answer, and our organization, TreePeople, is very interested in beginning to work in this area. So stay tuned on that. We have a question in the chat function here, and if anyone has additional questions, please try to use the Q&A feature. I know there are a few different features here. The question is from Nadine at Harvard Westlake. She says, hello, thank you so much. What a great collaboration and presentation. I have a question on how far above the ground surface temperature was measured when developing the models. I ask because we have a small school project where students have increased albedo in a parking lot, and while direct surface temperature decreases with increased albedo, the air temperature directly above the ground seems to increase with increased radiation from above and below. Dave, this might be a good one for you. Larry, I don't know if you want to take a stab. I'll let you decide which of you, or perhaps both of you, want to tackle this one.
I'll begin on this. There are standard heights to all of these temperature measuring gauges. These are all from first order weather stations, and most of them are somewhere in the order of 5-6 feet above the ground. So they don't want them to be so close to the ground to be affected by the microclimate, and of course too high to be out of the zone where humans are really affected. If you do experiments like this, there are things called Stevenson screens. They're official National Weather Service types of boxes that contain max and min thermometers, and they often also are somewhere between 5, 6, 7 feet above the ground. So that's usually the level that is measured when we get our data.
And I would just add, regarding the second part of this person's question, that as Larry mentioned, typically in measuring air temperature, you want to use some sort of shielding device so that you're not biasing your measurement. If you're interested in air temperature measurements, you don't want your sensor to actually be directly exposed to solar radiation. And so what might be happening, depending on how you made your measurements, is that if you just hold a temperature sensor out and you have more reflected radiation from the surface, that's going to be intercepted by the sensor, and the sensor might read a higher reading because of that, because you're not truly measuring air temperature. You're measuring the energy balance of the temperature sensor itself. So I would suggest that you focus on providing some radiation shielding for the sensors.
Yes, Google Stevenson screen. It's Stevenson. That's always the type that's used, and you'll get a good picture of it. You'll see that the shielding also allows air to flow through it because you want to make sure that there's a good airflow. So that's a good place to look.
Thank you, Dave and Larry. Okay, question from Kim Perez. This may be beyond the scope at this point, but I'm curious how the drought and the region's shift to so much drought-tolerant vegetation affects the urban heat island effect. There has been some research done on this. We do not currently have the capacity to take that question on, though we are interested in beginning to look, as I mentioned, at how different species perform. What we know just sort of generally is that the native types of vegetation that occur here, or climate appropriate vegetation that is good to to use in Los Angeles from other Mediterranean areas, can actually provide quite a lot of evaporative and evapotranspiration types of benefits. The issue that we have is when we go all the way to a more, quote unquote, xeriscaped desert-like landscape. So one of the things that our organization is personally very committed to is, dispelling this myth that we are in a desert region. While there are desert portions of Los Angeles County, Metro Los Angeles is a semi-arid Mediterranean climate. So, there's plenty of sort of, species and plant palettes that can be drawn from this drought-tolerant vegetation list or lists out there, which can provide very beneficial effects for the urban heat island. Another question that we have, does the algorithm on calculating deaths consider factors tied to vulnerable populations, for example, children, older adults, the chronically ill, homeless, etc.? Larry, this may be one for you.
Okay. Yes. It considers a couple of these things, but not all of them. For example, when these countywide mortality data, we don't know who the individuals are. We don't have names. So we don't know who is homeless. We don't know who is chronically ill. We do know the age of the individuals. So we can evaluate whether elderly versus the general population are more affected. Normally what we do is we look at total population and then we look at elderly population, which we usually define as 65 and older. We did not look at children because even though we do know that there is an increase in mortality related to heat in the very young, the sample size is often very low. So for this generalized model, we looked at both elderly and total. I gave you the results for total. We do have an algorithm for elderly as well, which would be a subset and would represent a majority of the deaths from heat-related mortality to begin with. But we can't go beyond that with the data that we've got right now because the county data do not provide us with more identity than what I just told you.
Thank you. Okay. A very practical question. Will the presentations be available after the webinar? We're recording this webinar and the archived version will be posted on treepeople.org/urbancooling. We don't plan to make the distinct presentations available because they're much more helpful with the narration from the presenters, so we will have the video up in a few days. Okay, another question here from David. Are all changes in albedo and canopy cover created equal? Meaning, is it anticipated that I'm not quite understanding how you wrote this, David, but is it anticipated that a 5% increase in albedo will be the same as a 5% increase in canopy cover, if I read that correctly? Dave, Larry, anyone who would like to answer this?
So this is Dave. I think the question actually is more focused on, depending upon your starting point. And so it's albedo / canopy of 2010 increased by 5%, say, I guess to 2515, versus a albedo and canopy level that starts at a much higher level, 30/20, increasing by the same 5%. So assuming that's the question, the answer is that not exactly, all scenarios are not created equal, because there are some non-linear effects in the atmosphere that are affected differently depending upon the actual surface albedo that you start at, or vegetative cover that you start at. But generally speaking, when we've done these sorts of sensitivity tests, the differences are not, it's not a dramatic decline in performance. So if you go from 20% albedo to 25% albedo, the benefit you get is same order of magnitude as the benefit you get if you start at 30% albedo and go to 35. So generally they're similar, but yeah, there are details in terms of how the atmosphere responds that make it not exactly scalable.
Okay. All right, so let's take a look here. I believe we're probably at the end of our questions at this time. Perfect. All right. Well, we would like to thank everybody for joining us today. Again, this webinar recording will be archived, so we encourage you to share it after it's been posted, as we would like to get this information in the hands of as many people as can make use of it. Thank you very much for joining us, and have a wonderful rest of your day.